Hello, everyone. This presentation is titled Baseline Renal Function Among HIV-Infected Pregnant Women Initiating ART in Lusaka, Zambia. I'm Wangiwa Mbewe from CIDRS making this presentation on behalf of my co-authors. As a background to the presentation, we know that the Zambia National HIV Guidelines recommend urinalysis for protein and serum creatinine as baseline tests for renal function among HIV-infected pregnant women initiating ART. This recommendation came into effect, particularly when we started using tenofovir-based ART in pregnancy. Creatinine results normally take about 2 weeks to be available. So we may not have the results the time that we want to start treatment. However, dipsticks proteins can be available immediately as point of care tests. And so decisions are made based on results of dipstick proteins. As a recommendation, dipstick proteinuria of greater than or equal to 2+ is used as a marker for renal dysfunction. And that's a contraindication to initiating TDF-based ART without results for a normal serum creatinine. In pregnancy, due to physiologic changes of pregnancy, serum creatinine is recommended as a marker for renal function rather than estimated glomerular filtration rate. In fact, some scholars have recommended a lower cutoff for renal dysfunction using serum creatinine in pregnancy due to the changes in pregnancy. In this abstract, we describe the baseline renal function as estimated by serum creatinine and proteinuria among HIV-infected pregnant women initiating ART in 3 health facilities in Lusaka. This study was part of a secondary objective of a randomized trial, which we conducted as part of an implementation science study on PMTCT in Lusaka. We investigated renal function using dipsticks proteinuria and serum creatinine in a cohort of HIV-infected pregnant women initiating TDF-based ART in 3 public sector clinics in Lusaka. The study was conducted between March 2017 and May 2018. We enrolled HIV-infected ART-naive pregnant women into the study at their first antenatal visit. That's at the time that they were having their first HIV diagnostic test. We collected demographic and obstetrical data, CD4 count, viral load, serum creatinine, and we assessed for proteinuria using urine dipsticks. We included all women who had both urinalysis and serum creatinine in their analysis and left out women who just had one or the other. The study was approved by the UNZA BREC and University of North Carolina at Chapel Hill. So we enrolled a total of 454 women in the parent trial, and out of them we had 393 or 86.6% with both baseline results for serum creatinine and urine dipsticks. The median age of the women was 27 years and gestational age was 22 weeks. Median CD4 count was 303.5 cells per microliter, and 65.2% of the women had CD4 counts below 350 cells. Median viral load for these women was 30,000 copies per ml. 3 women had serum creatinine above 125 micromoles per liter, and the median serum creatinine was 44.4 micromoles per liter. These findings are actually similar to what we find in other reports. Proteinuria of 2 to 3+ was present in 9 participants, which represented 2.3% of the women. The majority of the women had nil or 1+ proteinuria. This is just the data presented in detail. We had a serum creatinine median of 4.4, and then a serum creatinine above 125 micromoles per liter of 3, which is 0.8%, We also included a cutoff of greater than 75 micromoles per liter, as recommended by other scholars in a systematic review. And when we use this cutoff, we had 2.5% of women having serum creatinine over 77 micromoles per liter. 2.3% of the women had urine protein of 2 to 3 plus, with 97.7% of them having nil or 1 plus. So in terms of age categories, we had 34.6% of the women aged 18 to 25 years, 51.9% 26 to 35 years, and 13.5% over 35. Median gestational age was 22, with 5.3% presenting in the first trimester, 79.1% in the second trimester, and 15.5% in the third trimester. This is a continuation of the descriptive characteristics. We had median CD4 count of 303.5%, with 34.8% having CD4 over 350, and 30% CD4 between 200 to 349, while 22% had CD4 less than 200. 45.6% of the women had a normal HP, which we used cutoff of equal to or greater than 11 grams per deciliter. Most of the women had a normal blood pressure at 93.9%. This table shows associations between baseline characteristics and renal function as measured by serum creatinine among women initiating ART, tenofovir-based ART in Lusaka. So according to this table, there were actually no characteristics that were signifying impaired renal function using creatinine cutoff of 125 micromoles per liter. So from the data that we've presented, we found that baseline renal dysfunction as measured by serum creatinine and proteinuria was very rare in this population of HIV-infected pregnant women initiating ART. Considering that the majority of the women had advanced HIV disease as seen from the CD4 counts and also the median viral load, to move towards elimination of mother-to-child transmission of HIV, TDF-based ART initiation should not be delayed based on initial absent laboratory results in HIV-infected pregnant women, as most of them had normal renal function. Thanks very much. I'd just like to acknowledge the funders for this study, which was PEPFAR through CDC. It was an implementation science award, and that's the award number. We also had additional investigator support from NIH. And we'd just like to say that the findings and conclusions in the report are those of the authors and that does not represent the official position of the funders. I'd like to thank the whole B+ team and the participants in the study. Thank you.